So the question about vision therapy and when to start, it actually really depends. It depends on the age of the child, how many other areas are of concern. So I do like to see children pretty early. I like to see them before a year of age, sometime after 6 months, ideally, because between 4 and 6 months is when vision's really developing. But if there's a child that you have any concerns in terms of development, vision should be guiding and leading it. And if there is any challenge with vision, you can get in there pretty early and start working with them. As a birth to three provider in my state, I actually worked with babies in their first 3 years of life. Typically, at that point, I might see them every 6 to 8 weeks. Sometimes I'll see them just quarterly and give the parents suggestions to help develop those skills. If the greater problem is more the gross motor or core stability, we might recommend just starting with occupational therapy or physical therapy, and then giving some suggestions to the therapist as to how to develop whatever areas are a little weak. For example, if they have an ocular motor problem or an eye teaming problem, we might give some suggestions to work on those skills, and also a lot of bilateral work, because bilateral work helps with the binocular skill development. Or we might say, no, there's an eye turn that's really limiting the movement pattern, so we need to get in there and start with vision therapy early on, even at age 2 or 3. We'll tailor the vision therapy to the age, and ideally, vision therapy works best when there's support at home. So we will teach the parent as to what to do to follow through on what the child might be learning with us. And to me, as a parent, the key thing is to really look at what the developmental norms are. And again, oepf.org has a lot of good information as a parent's guide and checklist, which we use often. Your Child's Vision by Richard Kavner is another book. It's an older book, but it kind of gives you an idea of what to expect at different stages of development. And if your child's not meeting milestones, or if you have concerns that they're not making eye contact, they're not tracking, they're not learning in the way that you think they should, they're doing a lot of side looking or bumping into things, that's the time to actually start and address the visual system, and then help you to find a doctor that can help you to develop those skills and get that child to a healthier place. So for me, it's really knowledge is power. So as a parent, really knowing what is expected, and then looking at, what can I do to help? And again, too many parents we don't learn these things. We don't know about development, whether it's visual or motor, and we rely on the pediatrician or teachers to help guide us. So just empowering yourselves to really do a little bit of research, or take your child early on to an eye doctor that does do developmental work, to gain insight as to where the child is and what you can do as a parent to help them progress. So there's a lot of things that a parent can do, and a lot of it is just old school, playing with them, having them do obstacle courses, getting on the playground, doing eye-hand type activities, a lot of manipulatives and the old school toys, and staying away from screens. That's the other big thing. Thank you.